A phlebotomist collects a plasma sample using a light green tube but fails to invert it immediately. What error will most likely occur? A. Hemolysis of red cells. B. Serum contamination. C. Formation of microclots in plasma. D. Excess anticoagulant dilution. Answer: C. The light green tube contains lithium heparin, which prevents clotting only if mixed properly. Failure to invert immediately allows partial clotting and fibrin formation, leading to microclots that can interfere with chemistry analyzer lines. During venipuncture, the phlebotomist draws a sample from a patient receiving 4 fluids in the right arm. What is the best corrective action? A. Continue drawing slowly. B. Draw from the opposite arm. C. Discard the first tube only. D. Clamp the 4 line and proceed. Answer: B. For fluids can dilute or contaminate blood samples, producing inaccurate results. Always use the opposite arm. If both arms have IVs, collect below the 4 after it has been stopped for at least 2 minutes. A blood specimen for ammonia testing arrives at the lab at room temperature after 25 minutes. What is the proper action? A. Accept and process immediately. B. Freeze the plasma now. C. Recentrifuge and test. D. Reject the specimen. Answer: D. Ammonia levels are highly unstable and require immediate chilling on ice and transport within 15 minutes. Warm transport leads to falsely elevated results. Which of the following tubes should be used for a stat plasma potassium test if only one draw is allowed? A. SST gold top. B. Light green lithium heparin. C. Red glass. D. Gray fluoride. Answer: B. The lithium heparin tube produces plasma rapidly and prevents clotting, allowing for immediate centrifugation and testing, essential for stat electrolytes like potassium. A phlebotomist performs a draw and notices that the vacuum in the tube is lost before it fills. Which error is most likely? A. Needle bevel against vein wall. B. Excessive tourniquet pressure. C. Tube expired or cracked. D. Needle too deep into vein. Answer: C. Loss of vacuum is caused by damaged or expired tubes. The phlebotomist should replace the tube, not reposition the needle, to prevent unnecessary patient trauma. A specimen collected for coagulation testing shows clots. What is the most probable cause? A. Tube underfilled. B. Tourniquet released too early. C. Excessive inversion. D. Sample stored in ice. Answer: A. The light blue tube must be filled to its exact volume, 9:1 blood to anticoagulant ratio. Underfilling alters the ratio and causes clot formation. Which additive prevents platelet aggregation by chelating calcium most effectively? A. Sodium citrate. B. EDTA. C. Heparin. D. Potassium oxalate. Answer: B. EDTA binds calcium tightly, preventing platelet clumping and maintaining accurate cell morphology, crucial for CBC and ESR testing. A phlebotomist collects blood using a butterfly needle and short draw tube. Which adjustment ensures correct additive ratio? A. Use discard tube before light blue tube. B. Draw directly into EDTA first. C. Flush with saline before collection. D. Skip discard tube. Answer: A. Air in butterfly tubing can reduce the light blue tube volume, altering the blood to additive ratio. A discard tube ensures the proper ratio for coagulation tests. Which condition would most likely lead to hemoconcentration during venipuncture? A. Using a 23-gauge needle. B. Tourniquet applied for over 2 minutes. C. Fist pumping before draw. D. Drawing from hand veins. Answer B. Prolonged tourniquet time causes fluid shift from plasma into tissue, concentrating cells and analytes such as proteins and potassium. A phlebotomist uses alcohol to clean the venipuncture site but does not allow it to dry. What error may occur? A. Increased coagulation. B. False high potassium. C. Hemolysis. D. Low calcium. Answer C. Alcohol that hasn't dried can lyse red cells when the needle punctures the skin, releasing intracellular components like potassium and LDH. Which patient condition contraindicates capillary puncture? A. Severe dehydration. B. Infant heel edema. C. Adult with small veins. D. Diabetes mellitus. Answer A. In dehydration, capillary flow is reduced and can yield falsely concentrated results. Venipuncture is preferred for accurate plasma composition. What happens if a heparinized specimen is frozen before centrifugation? A. Clot formation. B. Hemolysis. C. Plasma separation failure. D. Additive crystallization. Answer B. Freezing a heparinized whole blood specimen before centrifugation can cause ice crystals to form, which rupture red blood cells, leading to hemolysis. Which blood test requires a chilled specimen immediately after draw? A. Lipase. B. Ammonia. C. Iron. D. Creatinine. Answer B. Ammonia must be placed on ice and analyzed promptly to prevent rapid degradation due to metabolic activity in the blood cells. During a difficult draw, the phlebotomist repositions the needle multiple times, resulting in hemolysis. Which analyte will be falsely elevated? A. Glucose. B. Chloride. C. Calcium. D. Potassium. Answer D. Potassium leaks from red cells during hemolysis, leading to artificially high results. LDH and AST are also affected. Which step ensures accurate blood-to-additive ratio in a coagulation tube? A. Drawing before serum tubes. B. Filling until vacuum stops. C. Mixing 20 times immediately. D. Using 21-gauge needle only. Answer B. Tubes must be filled completely until vacuum ends. Partial filling distorts the 9:1 ratio and invalidates coagulation test results. A phlebotomist accidentally draws from the arm with a dialysis shunt. What complication is possible? A. Hemolysis. B. High glucose results. C. Vein collapse. D. Infection and clot formation. Answer D. Drawing from a shunt risks infection, clotting, and damage to the access site. Only specially trained personnel should access these areas. What effect does an underfilled EDTA tube have on hematocrit values? A. Falsely high. B. Falsely low. C. Unchanged. D. Hemolyzed sample. Answer B. Excess EDTA from underfilling shrinks red cells by osmotic effect, lowering hematocrit and MCV readings. Why should blood cultures be drawn before any other tubes? A. To avoid false negatives. B. To prevent tissue thromboplastin contamination. C. To maintain sterile conditions. D. To reduce coagulation error. Answer C. Blood cultures are sterile specimens. Drawing them first avoids contamination from additives in subsequent tubes. Which specimen requires protection from light during transport? A. Bilirubin. B. Bun. C. Uric acid. D. Sodium. Answer A. Bilirubin degrades rapidly when exposed to light. Wrap the tube in foil or use amber-colored containers. What will happen if serum is not separated from cells within 2 hours? A. Glucose increases. B. Potassium decreases. C. Glucose decreases. D. pH rises. Answer C. Blood cells metabolize glucose after collection, reducing its concentration if not separated promptly. When performing heel puncture on an infant, where should the puncture be made? A. Central heel. B. Medial plantar surface. C. Lateral or medial plantar surface only. D. Arch of foot. Answer C. The lateral or medial heel avoids bone injury or osteomyelitis. The central heel must never be punctured. What is the main purpose of using sodium fluoride in a gray top tube? A. Prevents coagulation. B. Prevents glycolysis. C. Preserves plasma proteins. D. Enhances clot formation. Answer B. Sodium fluoride inhibits glycolytic enzymes, preserving true glucose levels for hours after collection. A phlebotomist encounters a patient with a recent mastectomy. Where should blood be drawn? A. From the same side. B. From the opposite arm. C. From the foot. D. From the hand only. Answer B. Avoid venipuncture on the side of a mastectomy due to impaired lymphatic drainage and infection risk. Which of the following tubes yields serum after centrifugation? A. Red top. B. Green top. C. Lavender top. D. Light blue top. Answer A. The red top tube contains no anticoagulant, allowing blood to clot naturally, separating serum after centrifugation. A specimen for lactic acid is drawn without a tourniquet. Why? A. Prevent sample dilution. B. Prevent hemoconcentration and false elevation. C. Prevent clot formation. D. Prevent oxygen exposure. Answer B. Prolonged tourniquet use increases lactic acid levels. The test must be drawn quickly without stasis to reflect accurate tissue metabolism. Which gauge needle is most suitable for patients with fragile veins? A. 18 gauge. B. 21 gauge. C. 23 gauge. D. 16 gauge. Answer C. Smaller needles like 23 gauge reduce vein trauma and collapse risk in elderly or pediatric patients. If a phlebotomist collects a sample through an indwelling line, what must be done first? A. Flush line with saline. B. Discard the first 5 milliliters of blood. C. Apply tourniquet above the line. D. Mix the first sample with anticoagulant. Answer B. The first few milliliters are discarded to remove 4 fluids or medications that may contaminate the sample. What can cause falsely decreased hematocrit results? A. Prolonged tourniquet time. B. Hemodilution. C. Inadequate mixing. D. Hemolysis. Answer B. Drawing above in foresight or in fluid overload conditions can dilute plasma, lowering hematocrit values. What is the first action if a patient complains of sharp pain during venipuncture? A. Continue drawing. B. Withdraw needle immediately. C. Adjust bevel angle. D. Finish and apply pressure. Answer B. Sharp pain indicates possible nerve contact. Stop immediately to prevent permanent nerve injury. A sample collected in a lavender tube is used for A. Lipid panel. B. Electrolyte test. C. Coagulation study. D. CBC. Answer D. Lavender tubes, EDTA, prevent clotting for complete blood count and differential testing. Which additive prevents conversion of prothrombin to thrombin? A. EDTA. B. Sodium citrate. C. Heparin. D. Oxalate. Answer B. Sodium citrate binds calcium reversibly, blocking clotting factors including prothrombin activation. Which step should be performed first if a hematoma begins to form? A. Apply pressure and release tourniquet. B. Continue draw to fill tube. C. Apply warm compress. D. Invert tube immediately. Answer A. Release the tourniquet and stop the draw immediately. Pressure prevents further bleeding under the skin. Which test result is most affected by hemolysis? A. Sodium. B. Bilirubin. C. Potassium. D. Glucose. Answer C. Potassium leaks from red blood cells during hemolysis, producing falsely elevated readings. Which factor affects the quality of a blood smear? A. Tube color. B. Spread speed and angle. C. Hematocrit only. D. Centrifugation time. Answer B. The smear must be spread at the correct speed and angle, 30 to 45 degrees, to create an even feathered edge for microscopic analysis. Why is it important to fill light blue tubes completely? A. To prevent hemolysis. B. To allow complete mixing. C. To ensure adequate plasma. D. To maintain calcium binding ratio. Answer D. Coagulation testing requires a 9:1 blood-to anticoagulant ratio. Underfilling skews results like PT and APTT. Which situation may require the use of a syringe instead of an evacuated system? A. Obese patient. B. Fragile or collapsing veins. C. High blood pressure. D. Pediatric collection. Answer B. The gentle control of suction in a syringe prevents vein collapse, useful for delicate veins. When collecting blood from a newborn, why is the first drop wiped away? A. To prevent contamination with alcohol. B. To improve flow. C. To remove tissue fluid. D. To reduce pain. Answer C. The first drop may contain tissue fluid that dilutes the specimen, leading to inaccurate test results. Which of the following could cause a falsely prolonged PT result? A. Overfilling light blue tube. B. Underfilling light blue tube. C. Incorrect inversion. D. Drawing before SST. Answer B. An underfilled coagulation tube increases anticoagulant concentration, falsely prolonging clotting times. What is the purpose of the antiglycolytic agent in a gray tube? A. Prevents calcium binding. B. Promotes plasma separation. C. Prevents coagulation. D. Prevents glucose breakdown. Answer D. Sodium fluoride inhibits enzymes that metabolize glucose, maintaining accurate levels for testing. A patient has N4 in both arms. Where should blood be drawn? A. Above the 4. B. Below the 4 after stopping infusion 2 minutes. C. From either 4 line. D. From hand vein only. Answer B. If both arms have IVs, draw below the 4 site after pausing infusion for at least 2 minutes to reduce contamination. What happens if a specimen is centrifuged before complete clot formation? A. Hemolysis. B. Clotted plasma. C. Low glucose. D. Fibrin strands present in serum. Answer: D. Incomplete clotting leaves fibrin in serum, interfering with chemical assays and causing instrument blockages. What test requires a chain of custody procedure? A. Crossmatch. B. Toxicology screen. C. Ammonia. D. Glucose. Answer: B. Chain of custody ensures specimen integrity and documentation for forensic or legal testing, such as drug screening. Which type of specimen requires strict anaerobic handling? A. Arterial blood gas. B. Blood culture. C. Lactic acid. D. Clostridium culture. Answer: D. Clostridium species are strict anaerobes and die rapidly if exposed to oxygen. Proper sealing is required. What is the function of thixotropic gel in SST tubes? A. Prevents coagulation. B. Enhances clotting. C. Creates a physical barrier after centrifugation. D. Preserves plasma proteins. Answer: C. The gel separates serum or plasma from cells, maintaining specimen stability and preventing contamination. Why should a phlebotomist avoid vigorous mixing of tubes? A. Incomplete mixing. B. Hemolysis of red cells. C. Tube contamination. D. Anticoagulant failure. Answer: B. Gentle inversion, 5 to 10 times, mixes additives without causing hemolysis. Vigorous shaking damages cells. What should be done if blood enters the hub but stops flowing? A. Withdraw needle slightly. B. Push deeper. C. Replace tube. D. Reapply tourniquet. Answer: A. The needle bevel may be against the vein wall. Slightly withdrawing can restore flow without new puncture. What is the main concern when drawing from the basilic vein? A. Pain. B. Artery or nerve injury. C. Vein collapse. D. Hemolysis. Answer: B. The basilic vein is near the brachial artery and median nerve, posing risk of injury if punctured incorrectly. What additive is used in a tube with a royal blue stopper? A. Sodium heparin or EDTA, trace element free. B. Citrate. C. Fluoride. D. Oxalate. Answer: A. Royal blue tubes contain trace element free additives, used for testing metals like zinc or copper. What must be done before performing a fingerstick glucose on a diabetic patient? A. Wipe with iodine. B. Warm the site. C. Clean with soap. D. Squeeze finger immediately. Answer: B. Warming improves capillary flow and yields more accurate glucose readings. Which test should never be collected from a fingerstick? A. Hemoglobin. B. Blood culture. C. Glucose. D. Hematocrit. Answer: B. Blood cultures require large sterile volume and cannot be accurately collected from a capillary sample due to contamination risk.